In this video, we're going to discuss the setup for an open heart room. The objective of the video is just to ensure that all of the supplies are organized in the same way and emergency drugs and drips are always in the same place so that they can be easily accessed and are ready for use. This isn't a style or nurse preference, but it's rather a system that we've developed here at Casa Medical Center that will allow us to always be prepared and be able to assist our team with less confusion and less chaos. If there's a scheduled open heart, the night shift can start the process by ordering 6 IV pumps for the open heart room, and also make sure that you order enough so that there's an adequate supply of extra pumps for the other patients in the unit. The next thing that you can do to start to prepare for the open heart room is make sure that the room assignments are rearranged so that our hearts will either go into bed 2 or bed 3. We also need for you to free up either the sport or the striker beds, as the other beds are not easily maneuverable to and from the operating room and don't have the footboard here. We want to make sure that you please remove all extra furniture that may be in the room, any chairs or any fans, and that the booms are properly situated so that the booms, the monitor is on the right side of the patient. It's really important in the event of an emergency or an open chest code. We also want you to make sure that you clear the back hallway to the ICU of any equipment so that there's easy access to and from the ICU. We would like for you to zero the beds as you usually do. The only thing that we would like for you to do is double line the bed so that after surgery we can just easily change the patient onto clean sheets. Next thing we need for you to do is set the transport monitor up onto the foot of the bed. These straps here are located in the bedside table that's below the iStat machine between beds 2 and 3. You need to take the brain out of the Nihon coated bedside monitor and insert it here into your transport cable, transport monitor. We want you to secure the straps with the monitor facing the head of the bed so that the anesthesiologist is quickly able to see your vital signs. The only other things that you need to send down with the patient are you need to send down an EKG cable as well as disposable cables. We need to send down your SpO2 and your CCO monitoring cables. At the head of the bed, we also want you to send down a pacemaker. We like to hang it here. A dual chamber if we have one. If we don't have one, we need to call for OR and we can borrow theirs. We also need to make sure that they go with the alligator clips. For the day shift, the OR will call to pick up your bed at about 9 o'clock in the morning. When they do call for the bed, please make sure that you ask for them to send up extra blood band labels. The first nurse that arrives will need to pull from the Omnicell your open heart tray here of medications. We also go ahead and take your PCA keys and we pull and override a propofol as well as a fentanyl. For the room setup, there's a lot of equipment that will send as a list, but we need for you to set up at least a minimum of 3 canisters. One will be for your chest tube, two will be for your suction or for your NG tube. We also need for you to bring in the Ranger. We now have 3 Rangers, so we don't have to borrow any from the OR. This is the Ranger as well as the tubing. And that's for your rapid infusion. You don't want to use any other rapid infuser because it delivers too much pressure and you can blow your grafts. We have a system here for setting up your lines, your drips. And the reason that it is a system is that so that in case of an emergency, anybody can jump in and you know that your lines are going to be the same. So on this line pole here, we set up 3. This is going to be for, you're going to prime an albumin line, you're going to prime a propofol line, and you're going to prime a lactated ringers line with your piggyback setup. We preset everything up so that when the patient arrives, you can just have everything ready to go. I don't have enough pumps here, but we also will put either 2 or 3 pumps. This will be your pumps that are set and ready. The one drip that we do pull and we prime prior to the patient's arrival is cardine, and you want to have that ready. Everything should be lined and labeled clearly. On the back of your pole here, you would set up your fentanyl PCA. Dr. Louis likes to have his patients wake and rouse before we start a basal rate. So we just set it for, it's a 10 per 1 syringe, and we just set it for 10 per 10 mics per 10 minutes. Yes, no PCA. You can double check your orders on that, but just basically set it up with no basal and check your orders. This will have your nicardipine set up, an empty line, and then we also like to bring in one blood tubing that's already primed and ready to go. So that's it for your lines. The other thing that you need to make sure that you have the room set up for is just get your Vig 2 set up, and Darcy already discussed in the Swan video just about how to slave this to the back of the monitor. And then the instructions on top of the Vig here, and this is just a calibration just to make sure that all the numbers are the same as what appears on the screen. In terms of everything else that needs to be in the room, you want to have your bear hugger and the blanket, as well as your SCDs, all ready, everything in the room. What will happen is the operating room will send you a scout sheet. It'll come up by fax. Check your scout sheet. They'll give you a 30-minute call. At that point in time, when it's 30 minutes out from the arrival of the patient, somebody needs to go down to blood bank and pick up your 4 units of blood. If day shift has forgotten to get the blood bank sticker, at that point somebody's going to have to go to the OR and get your sticker. You can pick up 4 units of blood that we keep in the room. We've been setting a timer on our iPhones because you have 4 hours to return that blood before we have to waste it. The other things that you can do once you get the scout sheet is the secondary nurse needs to put in all of your lines into the computer, set up all of your drains, your tubes, your lines, Foley, chest tube, pacemaker wires, and also on the scout sheet they'll tell you what drips are currently running. You'll get one more phone call prior to the time that they are actually transporting the patient upstairs. At that point, the charge nurse or the secondary nurse goes into your order set, and you want to delete all of the pre-op orders. It makes it cleaner and easier for you to go through your order set. The last thing that I want to go through is the paperwork that you'll need to do your open heart. It's also in the cabinet where the iStat is. On the bottom there's a file folder in there, and inside of that it'll have your PCA flow sheet, it'll have your Portland protocol, your insulin drip form. It'll also have your flow sheets for your I's and O's, as well as the flow sheet that we use to document your drips and your vital signs until you're able to take your vital signs that are in your transport monitor, take the brain out, and put it back to your bedside monitor. At that point, it'll slave over into your computer. The other thing you want to do when you get your final call is make sure that RT is aware that the time has come where the patient's going to arrive, and they will be ready. We also set up at some place in your room, usually it's where RT is standing. You want to make sure that you have your stickers for the patient, and on that bedside table you want to make sure you have everything for your labs. All your blood products are going to go down, your lab specimens will go down in a yellow bag. And you also want to make sure that you have everything labeled as much as you can. You have your iStat and cartridges, you have your glucometer and your test strips, as well as your tubings and your vacutainers and alcohol prep pads. So the big thing is preparation is key. Less is more in the room in terms of getting anything out of the way that you don't need, and making sure that everything is ready for when the patient comes out. We hope this video was helpful to you, and we'll see you at the next one.